Our agenda for this morning, we're going to talk a little bit about Mayo Clinic's social network and social media DNA and why that led to us having the Mayo Clinic social media network. Then we'll give you a little preview of social media residency, and it's really all about strategy. So the difference between social media platforms being toys and being tools is strategy. It's connecting it to what you're actually trying to accomplish. Cynthia is going to do a little session on how paid in social media is a four-letter word, but it's not a dirty one. It's just one of those things that is now necessary, but actually there are some pluses that come with that as well. We're going to give you a bit of a preview of what you might expect with a full social media residency, and I know Catherine has been interested in having the extended version as well, and so we hope that might be something we could do in the future. And also, one of the things that I'll be passing around a card a little bit later, we're happy to offer you, because of our relationship with Catherine, a 2-month free trial membership, paid membership in the so free and paid. So paid is a good free is a really good 4-letter word. Okay? Actually, it's still still 4 letters.
We're all got 4-letter words.
Yeah, well, so because of that, we've got a basic level of membership that is free, but then for you guys, because of the relationship with Catherine, we wanted to be able to offer that 2-month trial of the paid version of the premium version, and we'll give you a little bit of a preview of what you'll have access to as a result of that. Then we're going to have Catherine tell a little bit about her story and how she's taken advantage of these tools and applied them in her work. And then we're going to have an Ask Us Anything at the end. But I want you to know that applies all the way through. So anytime you have a question or a strenuous objection you'd like to raise, we'd be happy to talk, take them as they come. So we're not, we'll get this done in 90 minutes, so let's get into it. It was interesting, so some of it was fun to listen to the readout from the groups yesterday, and one of the things I thought was interesting was the experts by experience. Somebody raised the thing about how experts by experience. We actually have a book called Experts by Experience, and it's about, and it's patient stories. So we can collaborate with Inspire.com, and every other week on our Mayo Clinic social media network site, we publish an essay from a patient about their experience. Because doctors are the experts in the science, patients live with the disease every day, and they're the ones that have the experience of actually living it and what's it like to cope with it. So that was just an interesting thought. I also want you to know that if I can do this, you guys can do this, okay? So I just had my 56th birthday last week, so happy birthday to me. So I'm not a millennial, by any means, okay? And also, just to demonstrate, because I hate it if you were to think, oh, that's really cool that those guys can do that, but I can never do that. I just want you to know that you can do this, okay? And if I can do it, you can do it. My mom decided to give me for Christmas, I think it was probably like 6 years ago now, she found my 4th grade report card and decided to give it to me as a Christmas present. And so this is what Mrs. Jones had to say about me back in 1972. Under academic, it says, Lee's work has been average this period in all areas. Let that sink in a little bit. If you listen to Garrison Keillor and Lake Wobegon, where everybody was above average, this was before that time. Okay. Down at the bottom it says, Lee has difficulty keeping track of his papers. Occasionally he's late handing in assigned work. When we clean his desk, it's amazing what we find. So we're talking serious mediocrity here, okay? Right? So, and even not being a millennial, I can get this stuff, so you guys can get it too. So some of the other insights from yesterday that I thought were great, that really resonated with me in terms of what we're going to talk about today, start with where you are. What is your job? What were you hired to do? What's your vision? Just start there, and then look at these tools and do something that's practical and doable, something where you can just apply, what you're learning today and what you'll be able to learn through some of the online material we provide do something that's practical, take some steps in the right direction. Just don't let the perfect be the enemy of the good. Okay? It's really easy to get all tied up that I gotta just get it exactly right. I heard somebody say it in slightly different words yesterday, but I think that's a point that we all need to keep in mind. Don't just focus on the medical students, also residency and CME. Interesting thing with this online course that we have is it is CME accredited. So you'd be able to offer that to your faculty and for them to get, as part of perhaps a corporate membership, but you'd be able to at least get a sampling. Then teaching med students in an interprofessional environment. And then just look at what are the basic communication skills we need. We talked about taking the complete medical history and getting like sexual history and all that in terms of doing good communication. Well, I just submit to you that in the 21st century, social media skills are some basic skills that you need. Because that's where people are online talking about their conditions, talking about their experiences. And it's just part of that. I come from a public relations communication background. Cynthia comes from more of a marketing communications background. And we both recognized probably 10 years ago that if we're going to be relevant in today's marketplace and in the future, we need to have these skills. So this is your step toward starting to develop some of that. I also want to introduce you to a cool site, if you haven't seen it, called SlideShare. So you all watch videos on YouTube. SlideShare is where you can watch presentations and not just print the slides. So I'm just click through there and let you know that as I click through here, my slides for today, including my infamous report, are all on here. Okay, and so what's really cool about SlideShare is that people who aren't in the room, like you can tweet out the link, you can share the link on social, so people who weren't in the room and able to take advantage of the presentation, are able to see it and get some value from it. So I will be also tweeting out the link to this. We'll make sure that you have it as part of the follow-up materials as well. And just to note, like I clicked on that image there, most of the images that you'll see also are clickable. And so if you want to see the underlying site that we're showing, it's there. So preliminary on to Mayo Clinic social networking DNA. U.S. News and World Reports does its best hospitals rankings, and so yeah, I went faster on that than I meant to. So I forgot that I had to animate it automatically. So we're excited that our Rochester campus, ranked #1 nationally. Our Arizona campus ranked #11. The interesting thing, we have patients come from 140 countries in every U.S. state every year, and we're rounding error in the population sense in Rochester compared to some of these others. And so the question of that is, why did that happen? Why do we have people come from a distance like they do to a town that otherwise would be known for the world's largest corn-cob-shaped water tower? Okay, so we got that going for us. Some of you may have seen on PBS there was a special called the Mayo Clinic Made Open Science. It was a Ken Burns special. That's the 2-hour version of it, of the why. Okay, I'm gonna give you the 3-minute version of the why. It started with Dr. William Laurel Mayo, who was a surgeon in Rochester, Minnesota, a doctor he came to Rochester, Minnesota in 1864 to give physicals to Northern soldiers coming into the Civil War. 19 years later, a tornado ripped through Rochester, destroyed the town. It was a town of about 3,000 people at the time. Mother Alfred Mose, who was a local Franciscan nun, head of the local order, came to Dr. Mayo and said, the sisters and I want to build a hospital if you and your sons will staff it. They agreed to do that, and when the brothers came back, they became the physicians in this practice. The other interesting thing at that time was, in the 1870s, 1880s, 1890s, more people died of complications after surgery than of the disease that got them there in the first place because of post-surgical infection. But because of aseptic surgical techniques, and then that the Mayo brothers learned in medical school, and some fastidious Franciscan nurses, Franciscan sisters as their scrub nurses, they applied that. Along with better anesthesia, so it wasn't just bite the bullet, drink the whiskey, amputate, it was internal operations too. They developed a thriving practice where they had patients coming, they were on the railroad line, they had patients coming from several states. To the point where, this is from the official bio of the Mayo Brothers, in 1905 there were more operations done in Rochester, Minnesota, population of 3,000 people than anywhere else in the United States. And so McClure's magazine was the sort of the U.S. news of the day. And underlying all of this stuff was our first, this is the social networking thing, this is where that comes in. Dr. Will and Dr. Charlie, those brothers, recognized that with knowledge exploding so fast, they had to learn from others and bring those, they had to see what other people were doing and bring those lessons back to Rochester. So Dr. Will traveled in the spring, Dr. Charlie stayed home to take care of the patients, in the fall they switched places. This is from, again, from the Mayo Brothers biography. Interesting that by the end of the 1920s, Dr. Will visited every city in the United States and Canada to study surgery. That was part of the mix. I asked our historical unit, so what countries did he visit? Turns out here's the map, and here's the list of countries. He died in 1939. His brother died in 1930. This was before air travel. And this just shows that commitment to networking and the importance of it. They also had a group that was called the Surgeons Club because the train ran two directions. So they would invite people to come observe them in surgery just as they went and observed others. And so the Surgeons Club were, that was composed of people who came to watch the Mayo Brothers in surgery and paid $1 per visit, for whatever length. For 10 days it was $1, for 2 days it was $1. And then they would retire to a word. So the point of this is that social networking, which is like exactly what you guys are doing here today, face-to-face analog social networking is part of Mayo's DNA, and part of the DNA of healthcare. I mean, it's really related to what you're all doing. So as we look then at in our brand research at reasons behind preference for Mayo Clinic, we saw word of mouth was the #1 thing because of the patients who had survived and lived to tell their stories, the news stories, the internet. We saw that social media is just an extension of that. It's a way that word of mouth, that #1 reason for preference happens today. So social media is just digital social networking. It's taking these electronic tools, that same principle of communication, and expanding it and removing the friction. So our history at Mayo Clinic was I was hired in 2000 to be part of the media relations team. We were producing a series of TV spots that were news inserts for the local television stations, and many of them around the country were using it. We also started a daily 60-second radio segment. And when I heard about podcasting in 2005, it was about a year old at the time, 2005, I heard about podcasting. I said, well, we've got audio files that are already on our website. So this is kind of like some of those lessons you talked before. My way of saying it is proceed until apprehended. Okay. So we said, wow, podcasting, let's create an RSS feed and let's list it in the iTunes podcast directory, which was a month old at the time. This was one of those kind of fluky things. Because we were early with it, first mover kind of thing, we got featured on the front page of iTunes for about 3 weeks. Our downloads went from 900 a month to 74,000 a month in 1 month, because people could subscribe to have them sent. Now, this is kind of a hypochondriac podcast, okay? I mean, it's a 60-second radio spot. If anybody listens to podcasts, how many of you listen to podcasts, okay? Like typically they're 20 minutes anyway, 30 minutes, some are like 3 hours. They're really more in depth. So this is more like, here's the disease you can have today kind of thing. But it was the MP3 files that we already were producing for radio. And we said, let's just try it. So we didn't create a committee. We didn't, we just said, let's do it. So we also found out we were represented in social networks, whether we liked it or not. How many of you ever had a MySpace page? Okay. It's fine, there's no shame in admitting that, okay? But if you went to myspace.com/Mayo Clinic, this is what you would see at the time. We really love that brand imagery that they chose there. It turns out this was a British rock band that went by the name Mayo Clinic. They were kind of this metal band, not very good. In fact, I think probably the only people who listened to them was because of my presentations. But, so we love the brand imagery. I'll just warn you, this gets just a little bit worse, and we'll go by it quickly. So yeah, really bad. The good news about that, though, the only good side of that is that when we went to our leadership and said, hey, we need to get a Facebook page so that that British rock band doesn't do the same thing to us on Facebook that they did on MySpace, same day approval to make that happen. So 2007, 2008, we started using the free and cheap stuff. The flip video camera was just the coolest thing ever.
I found two, and we remodeled our office that hadn't even been opened.
Yeah. I mean, it was just this most amazing thing because instead of having to, do a tape, camera and then run that cord to the computer and play the whole tape through and digitize, you could just copy it over USB. Now, of course, with phones that, we'll get to some of the things that are possible now, but with live video streaming from phones, it's a thing of the past. That was part of our journey. And then in 2010, our leadership said, hey, maybe there's something to this. Instead of it just being an extra thing, we were able to get some additional staff, created what was then called the Man Clinic, Center for Social Media. And then externally, the way I met Cynthia was through what we then called the Social Media Health Network. They're all combined together now to become the Man Clinic Social Media Network. So I want to talk a little bit, bridge a little bit into strategy, and that's really that difference maker between what's a tool and what's a toy. So through the years, people like Cynthia and I have been involved in helping our physicians and other staff who are interested in marketing or communications. In the 70s, they said, I need the Yellow Pages ad. In the 80s, I need a billboard. 90s, I need a brochure. I need an email campaign. And now it's the first thing often they'll come to us is, I need a Facebook page. Okay. And it's sort of the whole thing, if the only tool you have is a hammer, everything looks like a nail. And so what we'll tell people is that you probably need a Facebook strategy. You may or may not need an individual Facebook page for your specific group. So some definitions around strategy. The strategy is the who and the why. Who are you trying to reach? Why do you want to reach them? The tactics then are the when and how and what to say. So that's and way too often, and the tools are then where to make the connection. So way too often, people come to us with one of these bottom line things like, I need an account here, I need a YouTube channel, I want to do something like that. And that's the tools. But they haven't necessarily thought through what is it exactly they want to accomplish and why. So when you choose the tools before you go to strategy, before you develop strategy tactics, this is the sort of scenario you get. And it just doesn't accomplish anything and makes the horse mad. So when we're doing our strategy development, we want to start by identifying that audience. Who are the people that you want to reach? Who do you reach now? Who do you want to reach? What are the goals? What do you want your audiences to understand and do? What do you want them to think differently about, and what kind of action do you want them to take? Then developing the messages. What are your main points, and then what will help cause that effect that you're seeking? So doing your reality check around that, you want to say, how well have you defined those audiences? And everybody saying, well, my audience is the general public. Not a good choice, okay? So if you were buying Super Bowl ads, maybe, okay? But if you're trying to accomplish something on the scale of what we're trying to do, the more precisely you can define your audience and looking at how they like to communicate and where they're gathering online already, you'll be more successful. Then looking at your goals, defining them in a measurable way so that you can say, okay, we've accomplished what that goal was. But then tying that all, looking at your messages, but then also making sure that it's consistent with your overall strategy. You don't want to have a social media strategy that's at cross purposes or not supporting what your organization is trying to do. Some other things related to tactics you want to take into account: learning style. Some people are visual learners, some people are audio learners, some people are kinesthetic learners. So kinesthetic learners, Twitter's great, okay? Because their hands are involved and they're like, it's part of how they think. Podcast great for audio learners. A large group of people are more visual learners. And so if you're not taking into account those learning style differences, you'll leave some folks behind. Then you also need to look at the online location. Where are your audiences already gathering online? And then looking at time of day considerations, calendar considerations, and seasons. Then it all comes down to developing an integrated plan to say, how can I coordinate our communications across all of our platforms, everything that we're, including print, including in-person sort of media, as well as the social sites, making sure that your style and your tone are consistent, and that you're inviting engagement with all. So lots of times in a direct mail piece, like you might include the URL to a blog that you have, or you might use the blog as the way of publishing articles that are already in a print newsletter, but giving it more global reach, and then also sharing within social networks, and creating that progression of engagement. And I want to talk a little bit now about what the link strategies are, so you can kind of see what an example of strategy looks like, and then we'll move on to some of the other things of our little mini session. So first of all, I mentioned the word of mouth is our most important factor for preference for Mayo Clinic. And so that's the foundation. Is like, if we look at where does word of mouth happen today, it's online. Okay? The people share their experiences on Facebook in particular, Instagram, Snapchat, Twitter, and so we need to harness these tools as well. So we want to reach the global audiences where they already are. There's a couple billion people plus on Facebook every month. And so that's going to be an integral part of most strategies. And then look at how can we either create or deepen those relationships with families. So first of all, if we get people to like us on Facebook or follow us on Twitter or subscribe to our YouTube channel, we're starting them from, okay, I'm just a consumer out here someplace, to somebody who at least is looking to Mayo Clinic with some kind of relationship. Then we've developed some platforms that extend that or deepen that. So these, for instance, are our Facebook, Twitter, and YouTube accounts. 1 million, 2 million, and then, subscribers on YouTube are a little bit less, a couple 100,000, I think. But anyway, that's that high level sort of relationship, as well as then on LinkedIn. LinkedIn is our business networking platform. So this is our top level connections. But then we look at ways that we can develop deeper relationships. So we've got the Mayo Clinic News Network, which is a WordPress blog-based community. And that's very analogous to what you'll see with the Mayo Clinic Social Media Network in just a little bit. But this is a platform where journalists who want to get access to video and audio resources before the public can create an account and sign in and get that level of access, but also then has that front face where it's the sense, I always say, don't just pitch the media, be the media. So this gives us a chance to publish our own news externally. And then for our patients and prospective patients, we have a community called Mayo Clinic Connect. So this is at connect.mayoclinic.org. It is the different thing about this. So it is intended as a patient-to-patient community. So it's not mainly a place for people to get information from Mayo Clinic, but it's that experts by experience kind of thing. Many of our experts by experience essay writers are these patients who are part of Mayo Clinic Connect. But instead of being on Facebook and having to use your real name and have all your friends see what diseases you're talking about, bless you. You can engage in online discussions. So this is sort of simulating scrolling down the page. So we've got some featured groups. We've got about 60 different groups organized around different diseases, conditions, and interests, including caregivers. And then on the front page, we'll also this is just a snapshot, obviously, but you'll see the most recent conversations. And there's a high level of interactivity there. But the beauty here is that people give us an email address and they create a username. They don't have to use their real name. So especially for people who are concerned about being out in public and being exposed and sharing their information, they can have these confirmations. They can make these connections with patients like them without having to give up that personal